Okay. TRBC count. So we already discussed the TRBC count, that is Haynes fluid, diluting fluid is Haynes. And what is the dilution factor?
1:200.
1:200. 200. Okay, very good. Then what is the formula? You know, overall formula N into? Yes, N into? See here. What is the formula? N into? N into 10,000. See, you already forgot. What is the normal TRBC count? 5.5 to 6.5 million cells per cubic millimeter of blood. At least do you remember this? Where we will count the cells? How many squares present in a Newborn chamber? Large squares. How many large squares present in Newborn chamber? 4, 5 or 9. Alright? Yes, Shivani. Tell me the area of Newborn chamber. Yes. See, you forgot everything. Okay. So let me show you the Newborn chamber again. So this is the Newborn chamber, right? The square. So it is divided into how many squares? Okay. Okay. It is divided into 9. Okay. Each square is 1 mm. Okay. So 3 mm. So yeah. Now these are large squares. 4 corner large squares. Large squares are subdivided into 4 into 4. Am I correct? What is the purpose of large squares? To count RBC. WBC. Here you are going to count the WBC. Right? And this is the central square. Central square is subdivided into how many small squares?
4.
4, 5, 10. Okay? See, even Abhinav also forgot. It is divided into 5 into 5. Okay? 5 into 5 square. Do you remember? The central square is divided into 5 into 5 and large square is 4 into 4. Okay. In the 5 into 5 central square, RBC is counted in 5 squares of the central square. Here, 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 here and central square. Okay. Yeah, there is an issue. So RBC counted in the central 5 squares, central small squares of the central small 5 small squares, right? And WBC is counted in large corners, large 4 squares, right? So this is where you are counting RBC and WBC. So now coming to the point. So where you will count the RBC?
Center 5 squares.
In the central 5 small squares. Okay. So that is TRBC. Okay. Then next one, TWBC. Right? What diluting fluid we are using for TWBC? Turks fluid. Very good. Turks fluid. What is the dilution factor? 1:20. What is the formula? N into? Yes. N into? N into 50. Okay, good. Okay, let me see. Okay. Normal value of WBC? 4,000 to 11,000 cells per cubic millimeter of blood. Okay. Then where you will count the WBC? In the 4 large corner squares. Is everything clear so far? Yes. Then next one. DLC. What is DLC? Yes? Differential leukocyte count. Is there any other name of DLC? There is no other name. The other name for TWBC is total leukocyte count. Sometimes it is also called as TLC, total leukocyte count or total WBC count. Now, tell me the ratios of cells of DLC. What is the percentage of neutrophils?
45 to 60.
Yes, 60 to 65 we can say. 60 to 65%. And what is the next one? What is the lymphocytes percentage?
28 to 30.
8 to 30. See, everyone is clueless. Percentage of lymphocytes. Yes, students. Okay, 20 to 40%. Right? Then, what is the percentage of monocytes?
8 to 10.
8 to 12. 8 to 12% monocytes. Then, percentage?
1 to 4.
Okay, 1 to 4%. Then,
Base.
final
Basiophils.
basophils. What is the percentage of
0 to
basophils?
1.
0 to 1%. Do you remember my mnemonic? What is it? Never let monkey eat banana. So that is the sequence. Never let monkey eat banana. Right? What stain we are using for DLC? What is the stain name used for DLC?
Leishman stain.
Leishman stain. Okay. Leishman stain. Okay. So, do you remember the principle of Leishman stain? Yes, tell me then.
Convergent.
Yes, basic dye will stain to the acidic part of the cell and acidic dye will stain to the basic part of the cell. What is the basic dye? Here in Leishman stain. For example, blue color, okay? Methylene blue, okay? Methylene blue will stain to the nucleus of the cell and not carbon. What is the other one? Safranin. Safranin will bind to the cytoplasm of the cell. Not only safranin, we have one more component integration. What is it, Abhiram? Safranin, eosin. Okay, eosin. Okay, fine. So, yeah, what cell has multi-lobed nucleus? Neutrophil has multi-lobed nucleus. What type of granules we have in neutrophil? Both acidic and basic granules are present in neutrophil. What cell has bilobed nucleus among them? Eosinophil has bilobed nucleus. What granules it has? Red color granules. Okay? Acidic granules present in eosinophil. What is the shape of monocyte?
Kidney.
Monocyte nucleus?
Kidney.
Bean or kidney shaped. Okay, almost kidney shaped nucleus present. What granules present in monocyte? No granules, right? No granules present. So that's it is agranulocyte. Okay, good. What is the shape of basophil? Sigmoid shape or some S-shaped nucleus might present. And what will be the color of the granules? Blue color. Yes, Mr. Raj. Where is your face mask and head mask? In the next lab, everyone must be in PP, okay? You too. Okay. This is all about DLC. Right? Then what else we learned in the last semester? BT and CT. Bleeding time and clotting time. What is the significance of bleeding time? For what purpose we are doing bleeding time? Huh? Yes, to assess platelets activity or their function, right? So how platelets are connected with bleeding time? So because activated platelets will cause, they will arrest the bleeding, then they will go for clotting also. So arresting of bleeding is mediated by platelets, right? What is the significance of bleeding time? For what purpose we are doing bleeding time?
Surgery.
Before surgery, actually, that is the primary thing. Before the patient going for any surgery, first we will perform bleeding time. Why we are performing bleeding time before surgeries? So there will be a huge, cuts. So we are going to do surgery and there will be a huge blood loss. If patient has less platelets, then there will be a heavy blood loss. So accordingly, we will arrange the units, blood units, how much blood units we might require, right? So actually, when there is a less platelet count, we won't even perform, we won't go for even surgeries. Sometimes platelet count is normal, but bleeding time is excess. Can we go for surgery? We cannot. That's why we are performing this one, right? Just having platelets doesn't mean he won't bleed. He or she might bleed. Okay, so we need to assess the bleeding time first before surgery. Yeah, that is the primary significance. Methods of performing bleeding time. Yeah, what are the three methods? Tell me, students. Finger prick method. Huh? Earlobe method. Very good. Earlobe method is called as. Okay, Duke's method. Very good. Duke's method. And any more? IVY method. What is IVY method?
Pressure.
In the presence of blood pressure, okay, we will keep cuff and we will keep one standard blood pressure 80 mmHg and we will prick from the vein, okay, antecubital fossa. So that is bleeding time. What is the normal bleeding time?
1 to 3 minutes.
1 to 3 minutes. Okay, average bleeding time is 1 to 3 and there will be slight variations among the methods we already know. Then what is clotting time?
2 to 3 minutes.
Okay, significance of clotting time. To assess the functional status of the clotting factors. I hope we already know, right? There are 13 clotting factors. For example, give me one example of clotting factor deficiency. One example with a disease. One disease example. What happens if there is no clotting factor 9? Hemophilia. So hemophilia happens because of absence of clotting factor 9 or 8. Okay, 8 or 9. Hemophilia A and B. Okay. Yes. Now tell me one interesting thing. What is clotting factor 4? Calcium. What is the significance of removing calcium from the blood? What if I remove calcium from the blood? Is it possible to remove calcium from the blood? It's possible or not? I got a blood sample and I want to remove calcium ions from the blood sample. Is it possible?
Yes, sir.
Yes. How?
Chelating.
Yeah, by adding some chelating agent. Chelation or chelating agents are that will remove calcium. They will react with calcium and they will precipitate the calcium. Right? So give me example of chelating agent.
EDTA.
EDTA. So by using EDTA we are removing calcium from the blood. So the blood cannot clot. The blood won't clot. So it will stay in fluid form. So we can go for study. Okay, why we are using EDTA blood? For what purpose in the lab?
It preserves all cells.
To study?
All morphology.
To study the cells. For CBC examination we are doing. What is the full form of CBC?
Complete blood count.
Complete blood count. Very good. Okay, good. What is the natural anticoagulant we have? Heparin. Very good. What is the oral anticoagulant we have? Warfarin. What is the mechanism of warfarin? Why warfarin, keeps blood in liquid state? Warfarin is also called as blood thinner. Okay, this is called blood thinner. That means it will keep the fluid state of the blood. How it will work? Do you remember how warfarin works? Do you want any clue? There are certain clotting factors that are dependent on vitamin K. Vitamin K dependent clotting factors. Do you remember? 7, 10, 2, 1. I given one diagram to you if you remember. Okay, 7, 10, 2, 1. Okay. So yeah, vitamin K is very much important for clotting factor 7, 10, 2 and 1. When we remove vitamin K from the blood, these clotting factors won't get activated and there won't be any clot. And who will remove vitamin K? Warfarin. Warfarin will block vitamin K activity. So those clotting factors cannot get activated and yeah, blood will be in liquid state. See, very interesting things. Yeah. So by this definition, in what circumstances we will proceed with warfarin therapy? For what purpose I will give warfarin to the patient? Think logically. Why I am giving warfarin to my patient? In heart attacks or heart diseases, right? So a patient got a recent heart attack. We suspected his blood might be clotted in the heart. To prevent further clotting of blood in the patient, we will immediately keep patient under warfarin therapy. Right? We given warfarin so the blood won't clot. At least there won't be any clotted complications like ischemic heart attacks. Is everything clear? Only few are understanding now. Yeah, okay, fine. Now tell me, let us see reverse engineering. We got a warfarin patient. I given warfarin to the patient and I performed BT and CT. What test levels will elevate? I performed bleeding time to a warfarin patient. I given warfarin to one patient and I collected his or her blood. And I performed bleeding time and clotting time. What will be the bleeding time of a warfarin patient?
Increase.
It will increase or it will decrease? Increase. Okay, so you are saying bleeding time will increase in the warfarin patient. What will be his clotting time? It will increase or decrease?
Increase.
Listen, in warfarin patient, clotting time will increase. Warfarin is only acting on clotting factors, not on platelets. So there will be normal bleeding time. In warfarin patient, platelets are normal. Platelets will prevent the bleeding. Okay, they blocked it, they stopped they arrested the bleeding. But the clotting will take more time because the vitamin K is not there in the patient now, right? So clotting time might increase. It might elevate or it will be normal. Bleeding time will be normal. Is everything clear?
Yes, sir.
Yeah. Now, a different scenario. If we got a patient and when we performed platelet count, what is the normal platelet count by the way?
1.5 lakh.
1.5 lakhs to 4.5 lakhs per cube. Very good, Niketan. Niketan is in full PPE. Very good. Raj, see. Yes, Miss Simran. Where is your PPE? Next time, okay?
Yes.
Okay, good. Okay. 1.5 to 4.5 lakhs. Right? That is normal platelet count. Decreased platelet count is called as thrombocytopenia. Thrombocytopenia. In case of thrombocytopenic patient, what will be the BT and CT?
BT increase.
BT will increase and clotting time will be same. It will be normal because he has clotting factors, but the platelets are not activating it. If we activate the clotting factors, they will have a normal reaction. Got it? Yeah. So now you understood the significance of bleeding time, significance of clotting time, their things. Then what is this bleeding profile then? Why we are doing this bleeding profile? What is the significance of bleeding profile? Yeah. What is bleeding profile by the way? What is bleeding profile? Do you remember? We discussed. This semester we are mostly focusing on bleeding profiles only. In this semester, extensively we are focusing on bleeding profiles. Yeah. Do you remember what is this? Okay, I will recall all the memories of you. So tell me the clotting pathway, coagulation pathway. Do you remember? At least at rudimentary level, basic level. Tell me what is a coagulation pathway. Tell me the pathways involved. Very good. Who said it? Simranjit. You are the best. Very good, Simran. Intrinsic and extrinsic. So either intrinsic or extrinsic, they both will make some common chemical. What is that? Prothrombin activator. They will make prothrombin activator. Now prothrombin activator will convert prothrombin to thrombin. Now thrombin will convert fibrinogen to fibrin, and fibrin will results in polymerization and clotting. Okay, so this is intrinsic, this one, and this is preparation of prothrombin activator. Then this is common pathway. Okay, this is common intrinsic pathway and extrinsic pathway. How we will assess intrinsic pathway? If there is any issues with intrinsic pathway clotting factors, what lab test will determine issues with intrinsic pathway?
PT.
Rob, do you remember? I said it.
APT.
APTT. What is the full form of APTT? Activated partial thromboplastin time. Activated partial thromboplastin time. So what is the significance of APTT now? Tell me. Significance of APTT? To identify any issues with clotting factors involving in intrinsic pathway. So to detect the extrinsic pathway issues, what lab test we are performing? PT. Are you sure? Yeah, PT. Then what common issues, common pathway issues will be detected by TGT and TT. Okay. Fibrinogen to fibrin by TT, and TGT will give the overall common pathway scenario. Okay. So yeah, these things we will discuss in this semester. At what circumstances we are going for bleeding profile? When we will recommend the patient to perform bleeding profile. Any idea? In what condition we are recommending? Okay, Acha, you should do bleeding profile. We recommend a bleeding profile to the patient. In what circumstances? Any idea? Guess the answers are here only. See, the patient got a elevated clotting time. There is an elevated clotting time. That indicates there is an issue with clotting factors. But we don't know what clotting factors missing in the patient. We have 13 clotting factors. But we know that some of the clotting factors present in intrinsic mechanism, some present in extrinsic, some present in common. So now what I will do? First I will do APTT, and APTT came normal. Then I understood, okay, these clotting factors are fine, no issue with this. Then I did PT. PT has elevated. Okay, there might be issue with either tissue thromboplastin or clotting factor 8 have some issues. And his common pathway also increased. Okay, that indicates he might have issue either with extrinsic or common issues. Okay, in common issue there might be involvement of less fibrinogen in the body, in the plasma. Maybe patient has less fibrinogen. That's why his fibrinogen unable to convert to sufficient fibrin to clot. So we are trying to assess the root cause of elevated clotting time in the patient. This looks simple, students, but this is very, very important. Patients will die due to internal bleeding when we are not treating them in time. I will give you a few examples. These patients will have issues like if the patient has these issues, if they are women, they will have excessive bleeding during periods. It will be a very excessive bleeding. Okay. In case of males, they will have internal bleeding. They will have hematoma. If they are running on a trap, or if they are going from 5th floor to ground floor on the stairs, by the time of they are reaching ground floor, their eyes will be very reddish because the bleeding happened in the eyes. Okay. There is a story I remember 4 years ago I saw an Olympic athletic. Okay, he died on the track because his heart has been bursted. Yeah, you just imagine when he is running, his heartbeat increased and heart has been blasted inside the chest cavity. Actually, that is called Morphine syndrome. You know what is Morphine syndrome means? His arch of aorta, the heart major aorta, has been blasted because that aorta is very thin. It's very fragile. It's like a paper. Since there is a sudden beat, the vessel has bursted and he died because of internal bleeding. That means bleeding can also. Okay, so all the clotting factors are normal, but still we are suspecting patient has elevated clotting time. Is it possible? Everything looks normal, but clotting time is still increasing. It's just a simple clotting time test. It's just a capillary tube breaking, but we are unable to identify the root cause. Got my point now? We did bleeding I got a elevated CT. I did bleeding profile. Everything came normal. How is it possible? How everything come normal when CT is increased? When it increased, there should be some abnormality here. Got my point? That means there are some other triggers. The triggers are causing some disbalance in the patient. When we don't know the exact trigger in the patient, we will tell a term called etiological. Etiological means some unknown reasons. Some unknown reasons triggering some problems in the patient body. Etiological causes. One of such causes, thin blood vessels. Thin blood vessel wall. When the blood vessel wall is very thin, it can cause this excessive clotting or clotting time issues. Okay. How blood vessel is connected with clotting time? Blood vessel has endothelial cells, and endothelial cells will release a chemical. Do you remember what is a chemical? 1 milligram factor. So there might be some issue with 1 milligram factor. Maybe these patients are 1 milligram factor deficient patients. That's why the CT is increasing. Even the normal parameters looks normal. Okay, the other parameters looks normal. See, a simple CT is giving a very deep insights inside the patient. Sometimes, another interesting thing I saw in some research articles, in some cancers, there will be an unknown CT increase. These cancerous cells will modify they will interfere with the cytokine exchanges. How to say? The way the cell communicating each other, that will be interfered by some cancer cells. So there will be abnormalities. Very interesting. Or a patient might have some leukemia, bone marrow cancers. Even in bone marrow cancer, there will be these issues, clotting time and bleeding time issues. Okay. Yeah. In this semester, we are focusing on these in-depth problems. Okay. In previous semester, we discussed small things, but we will go depth. So now you are getting some idea, right? What we will discuss here. Then coming to bleeding time again. The patient has a proper platelets. Okay, he has 5 lakhs of platelets. I did platelet count, and patient has 5 lakhs. That means more than sufficient. But he got an excessive bleeding time. Is it possible? The bleeding time is increasing, but patient has normal platelets. Is it possible? Yeah. How is it possible? We say that platelets will block, arrest the bleeding. But so what I did, there is an increased bleeding time. I expected patient has less platelets. When I did platelet count, it came normal. Normal platelet count, but increased bleeding time. How is it possible? Yes, Mukhtar. Mukhtar becomes cyborg. No, cyborg means robot. Yeah, it's completely covered up. Okay, you are forgetting these things. What are the properties of platelets? Yeah, tell me the properties of platelets. Activation. Sorry, attachment. That means adhesion. aggregation and activation. Attachment is mediated by 2B1A receptor. Aggregation is facilitated by another receptor and it will release some chemicals. Maybe platelets have issues with these three properties. Platelet count is normal, but they don't have the receptors required for this mechanism. So that's why the bleeding time again increased. Platelets are unable to attach to the collagen fiber. To the students who are unable to understand these things, the reason is you didn't understand the theoretical part. In the theoretical part, you need to know what is hemostasis, blood vessel rupture, cells, 1 milligram, collagen exposure, platelets, attachment. If you know that, then you can understand this. That's why you need to be in track. Then only you will understand. Anyway, that is the platelet disorders, and that we will discuss in this semester. Okay? Yeah. Then next, what other things we discussed in the last semester? ESR. Coming to the ESR. Tell me what is ESR? What is the significance of ESR? Tell me, students. Yeah, detection of inflammation. Detection of inflammation in the body. What conditions will trigger inflammation?
Sugar.
Sugar. Can you justify sugar, by the way? You said sugar. Yeah. How sugar will cause inflammation? He has some logic. Yes. Any others? Tell me, students. Allergic reactions. Okay. Some autoimmune disorders like rheumatoid arthritis or rheumatoid arthritis can cause inflammation. Actually, chronic inflammation. Okay, chronic inflammation. Can you give examples of chronic inflammation now? Tuberculosis. Okay, that is a gold standard disease we have. By the way, Mr. Archit Karambe, where is your PPE? Where is your face mask, head mask? You know? Next time, okay? Next time. Okay, very good. Tell me the methods of performing ESR. Windrows and Westerville's method. What tube has one end closed? Windrows, very good. Windrows, one end has been closed, and in Westerville's both the ends are open, right? Which tube is more lengthy? Westerville's 30 centimeters. This is 15 centimeters. Can you tell me the normal values of ESR? 3 to 5 mm per hour in males, and in females that will be slightly more. 5 to 7 mm per hour. Okay? Yeah. Yes. That is all about the ESR. Then, what is the significance of PCV? Packed cell volume. What is the significance? Yeah, to know the ratio between plasma and cells. That is a packed cell volume. PCV will give very deep insights of the type of anemia. Okay. If we want to understand the anemic status of the patient, we must know PCV values. Okay. So PCV is very important. What is normal hemoglobin? Yes, 12.5 to 16 milligrams deciliter. Grams per deciliter. Very good. Okay. Previously this value is up to 11, they say normal, but today it is 12. I need to check recent values. They might change it to 13. Okay. There are changes. Yeah, there are changes. They are constantly changing these values to give the status of anemia. Yes. Last time we didn't perform this practical because we don't have the apparatus. I already given the quotation for them. Let's see. Anyway, what is the method of identification of hemoglobin? Charlie's method, right? So, do you remember what is Charlie's method? Can you tell me Charlie's method? Yeah. Most of you are unable to tell the answer. I was very sad to the experiment. Yes, tell me what is Charlie's method?
We have to observe colors.
Yes, tell me. Do you remember? I will tell in a simple way. Listen. In Charlie's method, what we are doing is we are taking a test tube. Okay. We will add a drop of blood. To be precise, we are adding some, unit of measurement. There is a Charlie's pipette. With that pipette, we are adding a 0.5 ml of blood drop. I add to the test tube. Okay. Now I will add N by 10 HCl. I will add a known quantity of an acid that is called N by 10 hydrochloric acid. I have added N by 10 HCl. Now when I added N by 10 HCl to the hemoglobin, it will react and it will give a brown color, brown color solution. Okay, this brown color solution is acid hematine. Acid hematine. Okay, why it turned into brown? Because it is it converted to acid hematine. Okay, now it is in deep brown color. Now we will start adding distilled water drop by drop to this container. Okay, we are adding distilled water to this container and we will compare the color of test tube with a comparator, with a standard color comparator. Okay, this color should match with this color. The test tube color should match with the standard color. Until then we will add drop by drop distilled water. At one particular point, this color will match with the comparator color. That will be the reading of your HB. So there is a graduations here. So at what level you want the same coloration?
Can you repeat once?
Very simple. I got a rangoli color. Okay, I got a deep yellow color, and I have a normal yellow color solution. Normal yellow color solution is my standard control. Okay, what I will do is, to my deep yellow color solution, I am dissolving it with water. Up to this color matches with my pale color. Until the deep color matches with my pale color, I will dissolve it. At one particular point, they two will match equally. Okay. Now I will see the volume of, when I am adding water, the volume is increasing in the test tube. The upper level value will be the hemoglobin level. So it's a very interesting approach of understanding hemoglobin. By the way, this is not gold standard technique, but this is a simple technique to assess, almost real value of the hemoglobin. Okay. That is Stalish method, and we have colorimetric method also. We have colorimetric method, the best method. Okay, we are using colorimetry. Do you remember in biochemistry or the same B.S. Lambert's law? We will get the standard value, blank value, test value, we will multiply and we will do substitutions and we will get the values. Okay? Yeah. This is all about the hemoglobin. Next one. What else we studied?
Blood group.
Okay, grouping. You already remember. I guess everyone knows. Okay, tell me this group, students. What group is this?
B negative.
B negative. Very good. What group will be this one?
O negative.
O? Positive. Someone said O negative. O positive. Okay. What group is this? O negative. Okay, don't confuse in blood grouping. Who discovered blood groups? Again, still many people don't know. Arey yaar, he did his lifetime contributions. Almost 30 years he studied the groupings. Carl Landsteiner, okay. Carl Landsteiner. Okay, Carl Landsteiner. Okay, fine. What is the color of antisera A?
What's question?
Color of antisera A?
Blue.
Blue. Color of antisera B?
Yellow.
Color of antisera D?
Transparent.
Colorless. Very good. Okay, good. What antibody is present in B blood group?
A.
What antibody is present in AB blood group?
A and B.
Nothing. What antibody is present in AB group? Nil, okay? Nothing present. What antibody is present in O group? O, see, O antibodies, someone's A and B antibodies, right? Who is universal donor?
O negative.
O positive.
O
O
negative.
negative, not positive. Who is universal recipient? AB positive, okay? O negative is universal donor. AB positive is universal recipient. Okay, good. Yeah. Then what else we studied in the last semester? EDTA preparation. Ah, yes. Very simple. Then I hope you already know how to use this machine. What is this? It's a automated CBC analyzer. How many parts is this? 5-part CBC analyzer. Okay. So what is the difference between 5-part and 3-part? Can you tell me, students? Huh?
Parameters.
Parameters. Now tell me how many parameters in 3-part? Listen, students. In 3-part, it only gives three test values. It will tell TLC, RBC, and platelets. That's it. This cannot give me values of monocytes and lymphocytes. Got my granulocytes and agranulocytes. But a 5-part can give DLC, RBC, and platelets. Okay, along with TLC and DLC includes these two, granulocytes and agranulocytes. When we get the DLC, we are also getting TLC simultaneously. Okay, 1, 2, 3, 4, 5. Okay, that is the 5-part counter. Okay, graphs. Actually, it's just on software you are getting the values. Actually, simple. It's a cloud technique. What is the method it is opting? Principle of CBC analyzer. I discussed it. Principle of CBC analyzer. Flow cytometric analysis. Flow cytometry. Do you remember flow cytometry? Cells will go in a single profile. There will be two scattering. Can you tell me the two scatters? Side scattering. Forward scattering. Forward scattering will determine the size of the cell. Side scattering will give the complexity of the cell. Yeah. Okay, leave it. Then we'll see later about the CBC and flow cytometry. Okay. Let's see what is the time. 10:41. Okay. Yes. Shall we perform TRBC now? Okay, listen, in this semester, I'm giving some solid points. Wait, I don't want to record this session.